mothers make a choice on what they are going to feed their baby. You have two options, artificial milk or breast milk. The right choice is breast milk. One might ask, what is breastfeeding? U.S. legal defines breastfeeding is the practice of a woman feeding an infant with milk produced from her mammary glands, usually directed from the nipple. The infant extracts the milk from the breast through the instinctive suckling. The World Health Organization and the American Academy of Pediatrics, among others, recommend breastfeeding as the preferred method for feeding babies because its health benefits to the child and mother, states U.S. legal. Baby benefits include providing antibodies to protect baby from illnesses such as respiratory infections, diarrhea, and ear infections. Baby Center states the main immune factor at work here is a substance called secretory immunoglobulin, a IgA that presents a large amount in colostrum, the first milk in your body produced for your baby. Secretory IgA is present in lower concentrations in matured milk. The substance guards against infections and invading germs by forming a protective layer on the mucous membranes in the baby's intestines, nose, and throat. Another baby benefit is decreased chances of babies to have allergies. Also, because of the antibodies that the baby is getting from the breast milk. Also, it helps prevent and it helps develop good jaw, teeth, and speech. When the baby is sucking, it elongates the jaw and makes them fit close together and allows the proper jaw structure and development, and it also allows the baby to learn how to move their tongue for speech communication later on. It also may boost children's intelligence. Research has shown that children who have been breastfed have higher IQ scores and vocabulary tests versus those children who were formula fed, says Baby Center. Also, it's readily available to the baby. So when the baby's crying and its stomach's rumbling, the mom can just nurse the baby right then. The baby doesn't have to sit and wait. Where's my mom? Where's the milk coming from? So also, another benefit is it decreases the risk of sudden infant death syndrome, also known as SIDS. German researchers have concluded that exclusive breastfeeding, which is no water or other food products to your baby, including formula, until 1 month old, cuts the risk of SIDS in half. Also, breastfeeding is also beneficial for the mother as well. Some benefits to the mother is it reduces chances of different types of cancer. Breast cancer and ovarian cancer are the first ones that it also reduces. It reduces your risk of suffering a heart attack and stroke, says the La Leche League International. So if you're breastfeeding for more than 1 year, it actually decreases your chance of having a heart attack or stroke. Another benefit is it's readily available for the mom as well. So the mom in the middle of the night doesn't have to run to the store because they ran out of formula. So it's right there. Whenever the baby needs the food, it's available for the mom to just give it to the baby. This also saves the mom time during the day as well. And another benefit is it reduces your stress level, which reduces your chances of developing postpartum depression. Postpartum, the term post meaning after, and partum meaning birth, is after birth. So once you give birth to your baby, it's considered postpartum. And a lot of women suffer with postpartum depression. So reducing this risk of getting postpartum depression is very important for both you and baby. Another great benefit is losing weight, which I know many mothers have fears about this. So losing weight, the way that you lose weight quicker is because your uterus actually contracts, and every time the baby actually sucks from the nipple, that creates the contractions in your uterus. So by doing it a lot, when you're nursing your baby, your stomach's going to contract a lot more than it would if you were formula feeding. And also, you're burning more calories. The baby is actually getting a lot of your calories. Whatever you're eating, the baby's getting too. So it's sucking the calories from you and giving it to your baby. So you'll burn a lot more calories this way. Also, Another great benefit is delay return in your menstrual period, says the World Health Organization. And this can also be used as a birth control method. It's not 100% sure, 100% accurate, so you want to take other contraceptions as well. There are also rewards to breastfeeding. Some rewards are emotional bond with mother and baby. You get time alone with your baby. I know I remember when my children were little and I breastfed them, and just having that quiet time with them, looking down at them, and their eyes are looking at you, having that one-on-one with them at that time is a great bonding experience for both mom and baby. There's also economical rewards. First of all, it's free, so that's a great economical reward. You don't have to go out and buy formula, which formula can cost a lot of money, around $15 a can, roughly. Also, you have less diapers, so you're not buying as many diapers when they're breastfed because there's less waste than if the baby was formula fed. And lastly, the reward is feeling of empowerment. Producing food for your baby is very empowering. As a woman, you know, you're actually producing this food. Many mothers have fears about breastfeeding. Common fears are it's painful. And as long as they have a good latch, it's not necessarily going to be painful. I don't know if my baby is getting enough to eat. That could be a common fear. Just make sure, if you want to know, you can pump it into a bottle and it actually will tell you how many ounces you're producing, and that's how many ounces you're feeding your baby. And making sure that they're having wet diapers and stuff like that, measuring that. As long as they're having the normal wet diapers, you know your baby's healthy. Another fear is nipple confusion after you're returning to work. And pumping could be a fear of yours. And diet restrictions, which the diet restrictions are the same as your pregnancy restrictions. You just carry it through when you're nursing. And breast implants is another one of your fears. If you have any of these fears and you would like to know more about breastfeeding, contact your physician, and you can also contact a lactation consultant. To conclude, breastfeeding is the best choice that you can make for your baby. It has numerous benefits to both mother and baby.
Great.